Dive into the world of medicine with the Patient's Guide podcast, where we simplify the science and uncover the research behind medical topics.
Welcome back to the Patient's Guide. And today we're tackling something, well, maybe a little bit delicate.
Yeah, definitely not the usual small talk, but important nonetheless.
Exactly. We're diving into the link between your spine and your sex life.
It might not be something we think about every day, but trust me, it matters.
It absolutely does. And to guide us through this, we're turning to some research. Sexual and reproductive function in spinal cord injury and spinal surgery patients. Catchy, right?
Well, the title's a mouthful for sure, but it gets right to the heart of the matter.
For sure. And at the core of it all, this paper reminds us that sexual and reproductive health, well, it's a big deal.
Huge. It affects our relationships, how we feel about ourselves, our emotional well-being. You can't just separate it from the rest of your life.
And that's what's so crucial, right? It's about the whole picture. And what really struck me is how this research digs into the impact of spinal problems, injuries, even surgeries on everything.
It's all connected, and it's not always obvious.
Totally. One thing that jumped out at me was how the location of a spinal cord injury actually makes a difference in how it affects someone's sex life.
Yeah.
The higher up the injury, the broader the impact seems to be.
Makes sense when you think of the spinal cord like, say, a highway. An accident up near the top, that's going to cause more widespread disruption than one further down the road, right?
Now, this study, they used something called the Asia Impairment Scale to kind of figure out how bad a spinal cord injury is, how severe it is.
Right, which makes sense on the surface, but doesn't that seem like judging a book by its cover? It gives you a general idea, but doesn't really tell you the whole story, especially when we're talking about something as nuanced as sexual function.
You hit the nail on the head. It's just a starting point, really. Everyone's experience is different. And that's why this research, it points to another tool called the ISFSCI. Bit of a mouthful, but this one really zones in on assessing sexual function after a spinal cord injury. Okay, so more specific, got it. And one thing that's really important here, and I'm glad this research addresses it head on, is that men and women, we experience these injuries differently. We're talking about very personal experiences, right?
Absolutely. For men, it might be changes with erections or ejaculation. And for women, it could be things like lubrication, orgasm, even their ability to have kids. These are real concerns that people have.
And it's not just about the injuries themselves either. This paper also looks at how even common spinal surgeries, those that are supposed to help, can sometimes have an impact on sexual function. It's almost like you go in hoping to fix one problem, and you might end up with a whole new set of challenges.
That's such a crucial point. We tend to focus on the main reason for a surgery without always considering those unexpected side effects. Like this study looked at things like lumbar fusion, disc replacement. These are surgeries that a lot of people have, especially for back pain.
And while they can be really effective for relieving that pain, they have been linked to some unexpected side effects, like, for example, retrograde ejaculation.
Yeah, and with retrograde ejaculation, what happens is instead of the semen coming out like it usually does during orgasm, it goes back into the bladder. Usually it's not dangerous or anything, but it can be unexpected, to say the least.
Definitely not what you'd expect. It just shows how everything's connected and how changing something in one place can have these ripple effects elsewhere. The study even mentioned a possible connection between retrograde ejaculation and this thing called RHBMP2. It's a bone growth factor, sometimes used in spinal fusion.
Definitely an area where we need more research, for sure. But the good news is this paper doesn't just leave us hanging with the problems, It talks about what can be done, what can help.
Okay, because that's what we want to hear, right? Solutions. So what can someone do if they're facing these challenges? What are their options?
Well, there are actually quite a few options, which is great. Like medications, those can work well for some things, like erectile dysfunction. And for others, just talking to a therapist can be hugely helpful, especially when it comes to the emotional side of things, relationships, all of that.
Because it's about so much more than just the physical, isn't it? It's about the whole person, their mental health, how they connect with others, all crucial parts of the picture.
Exactly. And then there are things like physical aids, vacuum erection devices, for instance. Some folks find those helpful. And in certain situations, there are surgical options like implants. So there are choices depending on what's going on.
It's not a one-size-fits-all situation, that's for sure. Sounds like it's about finding what works best for each individual.
Exactly. And that's why it's so important to talk to your doctor. If you're having any issues in this area, don't keep it to yourself. They can help you figure out what might be right for you.
It all comes back to communication, doesn't it? The more we know, the better we can advocate for ourselves and get the help we need.
Couldn't agree more.
Well, on that note, we've reached the end of our dive into spinal health and all things related to sexual well-being. Hopefully you found this information helpful, maybe even eye-opening.
And remember, you're not alone. Don't hesitate to talk to your healthcare provider about any concerns you might have.
Thanks for joining us on The Patient's Guide.
If you enjoyed this episode of The Patient's Guide, you can find more below.